I want to talk about lumbar disc replacement. It's relatively new in the United States, but not really. It's been around for a while. It's been done in Germany and other countries in Europe for a long time. It was done in the United States, and then it kind of fell out of favor, and now it's being done increasingly more. Why would we recommend a lumbar disc replacement? How is it performed, and what is the recovery? We typically recommend a lumbar disc replacement for patients that have a bad disc, especially at L5-S1, that has not responded to other treatment. Patients really should not have a lot of arthritis associated with the disc injury. The time course of a disc injury is first a disc issue and then the arthritis. So if we're catching it a little bit earlier in the course of things, the disc replacement is a good option. Let me talk about the surgery itself. The patients come into the operating room. It's done under general anesthesia. And just like with an anterior lumbar interbody fusion, we go in through the front, through the abdomen. The general surgeon makes the incision and gets us down to the spine. The main risk of the surgery is injury to the major vessels, the iliac artery and vein that are sitting in front of the spine. Once the general surgeon gets those vessels out of the way, I scrub in and do my portion of the surgery. I take the disc completely out, including any disc material that's herniated and is possibly affecting the nerve. We then put this implant in, and it is secured into the disc space in two ways. Number one, there's a keel that is cut into the bone. And number two, it's a press fit. The spine is distracted open, and then it settles onto the disc replacement or the device that we're putting in. One risk of surgery is that the implant migrates, and that is the reason why it fell out of favor a few years ago in the United States. Some of the earlier implants had a higher risk of migration, and or the surgical technique that was used to put them in was not fully understood. And the migration of the implant can be a significant issue because it's next to these vessels again, and now you're dealing with scar tissue. Fortunately, the migration risk is extremely low. Once the implant is in and we're happy with everything, the general surgeon closes the wound. Patients typically spend 1 to 2 nights in the hospital, and we're mostly looking for the ability for them to eat and their bowels to wake up from the approach. The recovery, I would say, is about 4 to 6 weeks of being stiff and sore and of being reminded that you had surgery. We want the patients to be up and moving and active and paying attention to how their body is feeling. Lumbar disc replacement surgery has good outcomes, and in the right patient, it's a good surgery. I think that they can be safely done here. Patients sometimes will go to other centers, especially over to Germany, to have the surgery done. I have no problem with that, but I kind of like to see patients be able to stay in our community, to feel like they have a connection with a provider, good follow-up and long-term follow-up care if needed, and not have to undergo the risk of lengthy travel plus the expense. We've had good success with lumbar disc replacement surgery, and again, the main risk, I think, is injury to those major blood vessels, which fortunately is uncommon. Another uncommon risk is that the implant migrates. Finally, in a well-selected patient, the outcomes are very good, and the patients are quite happy to be able to move and have their pathology addressed without affecting negatively motion by doing a fusion.